Good evening, viewers, and welcome to the book launch of Young Mental Health by Amrita Tripathi and Meera Haran Alva. Mental health is a topic that is still not freely spoken about in India. Individuals feel that if they talk about it, or indeed come out about issues that they may be facing with regards to the same, they may be ridiculed or hushed up. Consequently, even an activity such as talking to a counselor or seeking help can seem like a daunting task. For young adults living in India and indeed the world today, this is a particularly pressing problem as issues of image and peer pressure also come into play, all the more compounded by the proliferation of social media. Through the Mindscape series of books, Amrita and her co authors attempt to normalize mental health issues as something many of us need help with, and to let the reader know that they are not alone. As mentioned today, we are focusing on the latest addition to the series, Young Mental Health, and we have an eminent and experienced panel on hand to discuss this most pressing issue. Dr. Amit Sen, who is the co founder of Children First, Paras Sharma, who is the co founder of The Alternative Story, Pattie Gonsalves, who is project director at Sangath, Meera Haran Alva, psychologist and co author of Young Mental Health, and finally, Amrita Tripathi, co author of Young Mental Health and founder of the Health Collective. Hand it over to Amrita to continue the discussion.
Thank you so much, Abhay. And in fact, the entire Simon & Schuster team, Himanjali, our editor, who first discussed this Mindscape series with me quite some time ago. I do it's usual to have a virtual book launch, but here's a Kindle version for those of you who want to download the book. It's the new normal, right? So Meera, Pattie, Dr. Sen, Paras, thank you for joining us at this launch party in a way. I want to tell everyone that it has been an enormous team effort, very much a collective effort to get this book off the ground. As you'll see, we have multiple and wonderful contributors, people sharing both their own stories as well as their expertise. The Health Collective is about 4 years old now, and we've been collecting, we have about 300 stories now on the site. Some of them in this book, where we sort of built on interviews we've done, where we built on some of the stories we've gotten. And we also have comics and people sharing some of their stories via the comics. So what we're going to do is take you through a little bit of what you can expect from the book, talk about why it's important to even have these conversations about young mental health. And I'm going to start by, again, acknowledging this incredible panel, our incredible contributors, but take the responsibility for any errors that might have crept in. We do want to hear from any of you who are watching. You can feel free to ping your comments or questions in, and we'll pause and take them. Let me start with you, Meera. Firstly, thanks again for embarking on this journey with me and with all of us. Let me ask you why you thought it was important, if you did, I'm going to hope you did, think it was important to be part of this book and to talk about young mental health.
Yes, of course. I mean, it's absolutely a thrill and what an opportunity. I feel it's such a relevant space and topic. And I feel really it's an amazing collaboration of work, all of us coming together. And I think it's also very reflective of the systemic change that I'm seeing now in mental health, is that from the very expert medical model to us having more of a collaborative relationship in terms of even the therapist and the client. So I find that the book really reflects that, and I'm so glad that I can be part of this discourse, new discourse of looking at mental health, destigmatizing the mental health issues, also really kind of looking at therapy as not something to be ashamed about or a taboo, but actually something that it's okay to seek help, to reach out. And I'm really glad to be part of this journey and this process and this change that we're seeing at this point of time.
Thanks so much. And, just picking up on that point, Dr. Sen, thank you so much again for agreeing to write the foreword to our book and, of course, being so generous with your time. I feel like I've been interviewing you for more than a decade now and learning from each one of those interviews, including what we have in the book. It was really important for us to have these conversations in a more accessible way. So, picking up from what Meera was saying, having these conversations, not necessarily what people are used to in a more academic setting, perhaps. Could you share a little bit on your thoughts on the book and having this conversation today?
Yeah. So firstly, thank you, Amrita, and thank you, Meera, for actually including me in this this process, in this movement. I believe it's a movement, and I think that we at Children First also have been partaking of this for at least 10 years or more. And I think the need to have conversations which are accessible to the general public rather than mental health sitting in some very mysterious corner, perhaps scary corner, where nobody wants to tread, and nobody, there's so much of fear associated with this. There's so much of stigma, and that still is. Although, like Meera was saying, I think that things have been changing, and hopefully, we have all of us here, who have probably in our own spaces trying to normalize these conversations, have contributed to this movement that we see now, where mental health is talked about so much more, whether it is in the media, whether it is in schools, or in NGOs, in the wider community. So indeed, it was such a good opportunity for me to participate in this, both as somebody who might have had experiences with children and families over the last few decades of working in the space of child mental health, but also from a very personal point of view, because I do believe that I have ADHD, and I've had my own struggles through my growing up years, and even now, and how that impacts relationships, how that impacts your the view of the world that you hold. Once you have gone through it yourself, you understand it in a different way, I believe. And I think that some of us here who have gone through that experience, perhaps puts another layer to this whole the book, the discussion, and all of that. Yeah.
Absolutely. Thank you so much, Dr. Sen. Paris, let me ask you, because you have been so open about so many things, including living with anxiety. For anyone watching, Paris tweets at Wise Donkey, and that's also his Instagram. And it's really something to follow along with his journey. You've been very, articulate about some of the issues, but also in calling out the movement that needs to be intersectional, right? Do you want to share a little bit about why it's so important to address some of these nuances, even as we try to reach a wider audience?
Yeah, I mean, as I was just, getting ready for today's discussion, I'm sure everybody's seen the news about, Sushant Singh Rajput's death by suicide, and I think it just tells you again that the conversation has completely moved to let's talk. And I always keep saying, as somebody who lives with anxiety and depression, that it's easy to say let's talk or reach out or seek help, but how does one access help? I mean, people want to talk about awareness, and if mental health services are not intersectional, they'll keep ending up serving the same small subset of society over and over again. So intersectionality, I think, for me, as a mental health provider and as a user survivor, means that help is made accessible. It's not just telling people go out and seek help. And it's not just mental health professionals saying that, hey, we can help you. It's also us as mental health professionals talking about our own vulnerabilities and not creating this entire hierarchy as, we are the experts and we're here to heal you and you are the ones who need to be healed. I think making ourselves look reachable and accessible, and also making, services accessible in whatever way we can, has been a very important part of the work that we are doing here at the Alternative Story, and my own journey as a mental health professional and as a user survivor, because I don't think we can answer any of these challenges without widening the net. Just saying, let's talk about it, mental health matters, and all the hashtags do only one part of the job, but it has to include, the marginalized as well.
Yeah, 100% agreed. And Pattie, just to bring you in there, it's something that you've been so vocal about as well, the work that you're doing, including trying to expand access to help, right? Working with sort of peer counselors, laypersons. Can you share a little bit about why you think it's so important to talk about young mental health today?
Yeah, I mean, just to add on, I think, to what others have already said, I think, and also sort of picking up on your point, Paras, just now, I think making mental health conversations part of daily dialogue is just, I mean, it's so important, particularly, I mean, in times of today, and I'm sure that's going to come up, the situation we've been in for the last couple of months. But I mean, from sort of two perspectives that I work from, the first being sort of research around what helps young people the most, and the second around, highlighting people's personal stories as a means or as a road towards understanding mental health better. Mental health is young people's mental health specifically is probably the single most important and pressing health issue in India right now. So I think this book is helping to elevate that. It's helping to highlight that, and it's doing it in a really sort of conversational way. So I'm hoping, that parents or teachers or principals or young people themselves think that this is a resource that they can pick up and read. And I think, again, in the coming months, maybe in the coming years, again, especially in light of COVID, I think we know that young people, especially in India, are going to be impacted probably more than any other demographic. So I think, prioritizing their mental health is going to be extremely important. And these are projects that will help us make a better case for that.
Meera, I want to come in on the fact that we're, sitting in the middle of this COVID-19 pandemic. We know that people are feeling, there's spikes in anxiety, there are more concerns than ever. Any suggestions you have? And we'll come to all of our panelists, but starting with Meera.
Yeah. So I think it's important to acknowledge first the emotional toll this is having on young children. And I think the way to acknowledge it is to talk to children about it, to have those conversations that Pattie mentioned, is that make it a part of your daily conversation, because there's so much fear lurking, very real fear of death. And then plus the lockdown, being cut off, being isolated, a lack of connection. That's something that I see a lot with the young people that I'm working with, is this feeling that, I have to deal with all this uncertainty and anxiety and real fears, and I'm also cut off. I feel disconnected. I feel this, lack of connection with the others, and a sense of really feeling locked down and being on my own. So the isolation is a very, very important thing that I'm seeing. And so in terms, there's no really an easy way to address this. It's a pandemic after all. So we really need to think of multiple ways to deal with this. But one of the basic things is to acknowledge, start having conversations about this, of course, building support and building networks, I think connections, and having a plan to connect. Like, you have to find new ways to connect with each other. So this is a very strange situation. We need to find newer, creative ways to connect with each other. So these would be the couple of things that I feel that might be quite important to look into at this point of time.
Those of you who are joining us, we're talking about young mental health and many issues to do that might come up. Feel free to share your comments or your questions. We'll also try and answer them live, and if we miss any, we'll come back to them later. Dr. Sen, do you want to weigh in on some of what we're seeing? I know Children First, and as Pattie was also saying earlier, I mean, it's hard to have these conversations. And from what Paras was saying, it's not just a hashtag. It's not about just paying lip service. How do we have these real, authentic conversations and acknowledge the fact that there is fear, there is anxiety, there is uncertainty at a time like this?
Yeah, so I don't think we've ever in our lifetimes, most of us haven't seen anything like this. It's brought our world upside down. And besides, of course, the physical threat of contacting the virus and the other questions of life and death that it brings, it actually also creates a kind of a paranoia and a mindset, which polarizes people. So, like Meera was saying, the fear is so palpable. And of course, I mean, the right thing to do, I suppose, is to do all the things that states are doing by isolating, with the social isolation and what have you, and all the measures that you require to deal with it physically. But the way it's being dealt with and the kind of psychological impact that it's having on people's life due to the lockdown, and how when somebody tests positive, the way it's being carried out, some people are writing about their experiences. Shalini Langa is one who wrote in the Indian Express today about her own family's experience, beautifully written and completely shocking in the way people who contact the disease are treated. So there are many layers to this, and the psychological impact of it is much like what you would get in a huge disaster situation, like a massive tsunami or an earthquake, but this is global. It's affecting everybody. And while in a particular disaster situation you have an event, and then you have to deal with the aftermath, this is ongoing. You just don't know when it's going to end. So the confusion and the unpredictability, the breakdown of systems, including the rituals of daily living, or the institutional breakdowns of everything, of schools, colleges, offices, organizations, public transport, everything is breaking down. So what do you bank upon? What holds you together? Where is the scaffolding? So I mean, we oftentimes, when we go through our own personal journeys of mental turmoil or relationship difficulties, what we bank on are some of these things. Even the opportunity to go out and do something which is pleasurable, which gives you joy and meaning in life, right? Simple things like going to a museum, or going for a coffee with your friend, or going for your morning walk. These are choices that we make, and they actually make the people who that we are. So our identity is actually based on the work that we do, the choices that we make in the world outside. The connections are not just social, the connections are with different spaces in the world outside us, and all of that is for the moment at least gone, and we don't even know when it's going to return. And that is an unprecedented phenomena, I believe, that and nobody knows how to deal with it. So what's happening as a result is, of course, it's a huge there's a lot of hue and cry about domestic violence rising, anxiety and depression rising. Now suicides even of famous people, that's beginning to show up and all that. But what the danger here is that because there's so much of confusion and lack of clarity as to what's happening in people's life, that it begins to become a mere statistic after some time. I mean, the mental health scenario in young people was bad enough. I mean, I don't want to rattle off many statistics here, but it's probably going to add to that. I mean, right now, WHO would say 20 to 30% of young people have a diagnosable mental disorder. It's probably going to reach 50%, in the way things are going. But if we just look at those statistics and do not look at lived human experiences, and that is what your book actually has focused on, and that is why it's so refreshing. Till the time we are able to have conversation in emotionally safe spaces, till the time we can have this where people, and again, the reason why I opted to, let's say, for instance, talk about my own difficulty is because of the conversations I had with you, Amrita. And when I saw some of the other contributors, I found that indeed this is an emotionally safe space. In another space where I've attempted to do so, including a professional spaces where I might have said it to my professional colleagues or a friend, I think I might have ADHD, and usually it's just brushed aside. It's taken as a joke. You say, oh, we all wear our diagnoses on our sleeve and so on. So I mean, it feels. I've had such experiences, right? And so you recoil back and say that this is not the forum to talk about it, because the acceptance, the openness to say that as a therapist or as a doctor, I can also have difficulties in my life, to be able to say that out loud, and to feel accepted, to feel held, to feel that there are people who will empathize with this is another matter altogether. So yeah, indeed, the COVID crisis is going to create huge amounts of statistics in terms of disorders and suicidal attempts and interpersonal conflicts and so on. It all depends on how we deal with it. It's a huge opportunity, again, to be able to open up these conversations more and more. We have been trying to do that as much as possible in the different organizations.
No, and I think
Sorry,
picking up on this. No,
Go
it's all good. This is as you said, safe space. As far as I'm concerned, you can just take over the rest of the conversation, all of our panelists. I think that it's hard. I think what I really appreciate about each of you is that, you're going to bat every day. It's not just about saying the things that people want to hear. It's about having complicated conversations and sharing so personally. Dr. Sen, I really appreciate that you did so. I want to take a moment to thank people who are watching us. Venkatesh, thank you for joining. He's saying, wonderful to be here. Congratulations on the launch of this timely book. Siddhant Agarwal congratulating the book, saying he's sure it's going to help a lot of people. And Rinchal Pamo, that's a great question. I'm going to come to that in a second. Paris, we have talked about in the book suicide being the leading cause of death in young people. That's the age group of 15 to 29. And today, as you pointed out, we got this news of the tragic death of a young actor, 34-year-old actor. Suicide prevention is something we all need to learn to talk about, to share that resources and helplines are available. And I do want to address this with a trigger warning, but also to say we have helplines out. We're tweeting them. I think all of our groups are doing the same. Why do you think it's so important? Why is it so difficult for us to have these conversations in the first place?
Right. I think part of this is centered around the fact all the conversations about just keep talking about the fact that suicide, the act of suicide is the last act in a series of actions where the person gives you a lot of hints and gives you a lot of signs that they need help. And I think we got it figured the wrong way. When we talk about suicide prevention, but I think what we should be talking about is creating an environment where the vulnerability in itself, is abated and it is brought down in such a in an effective manner. Listening to Dr. Sen speak reminded me of a meme that I saw recently, and I related very hard to that. Being a young person today is like experiencing this the great time at this point in time, and in the last 4 months in itself, and that's a lot of stuff. When you answer, and I think this is the time where vulnerability starts building up. Unfortunately, the resources are only towards preventing suicides, but what about preventing distress? I think that's the bigger. We have timely conversations, and we have people listening in. And you and Meera have been an empathetic witness to my story, and I'm hoping that when people read the book and read our stories, I hope that they find that there are spaces available to have these conversations with therapists, with trained peer professionals, and of course with their friends. I think when we do that, we will see that fewer people go towards suicidality, and I think ultimately that's the aim that we need to try and when it comes to young people's mental health. And I really hope that this book helps galvanize a lot of people towards coming to therapy much earlier than before they become suicidal.
Thanks, Paras. Meera, Pattie, can I address this question to you from Siddhant? What do you think the reason is that people shy away from using helplines, apart from the taboo that our society has when it comes to mental health and mental illness? Perhaps we can just expand on that a little bit, because you both are, of course, more than aware of the issues to do with stigma and then lack of access to help. Meera, then Pattie.
Yeah. Okay, so I think yes, the obvious reason other than taboo is one of the main reasons, but I think one of the other things that I have come across happening is that there is minimizing and dismissing of the initial suicidal ideation or kind of conversations around that when it's revealed, especially when children come up and tell their parents. I've seen that happen so frequently, and it's brushed away. So I think a part of not picking up the phone and calling is also the lack of validating that feeling. It's always this feeling that it has to escalate to a certain level for something to happen. And I think this is again comes to the other issue of people waiting for escalation to happen in order to get help. So I would say the issue is that, again, the not having to escalate, see how escalated a matter is before you get help. Get help right when you feel that you're feeling some sort of suicidal ideation, there's self-harm, any sort of ideas around, thoughts of killing yourself or even depressive thoughts, get help right then. So I think it's not just the taboo, but it's also just the escalation and waiting for something to be a lot more intense before you get help. I think that's one of the things that I see happening frequently.
Yeah, and I mean, I would sort of take it a step back from there. Even, I mean, part of what we are trying to do in our work is also just like talk about mental health for the general population, and taking a step backwards to say, like, how do you even reframe the idea of mental health as something that is for everyone, and sort of reinforcing this idea that everybody has mental health. We all have mental health. And unfortunately, I think the way the sort of the taboo comes in and how people think about it, when you hear mental health, you're thinking, you are thinking suicidal, you are thinking, oh, this person must be mad or crazy or depressed or anxious and so on. But I think being able to shift that framing to something that's positive. So, trying to really emphasize the idea and drive home this idea that our mental health is so much more than that. And taking a sort of a full view of it as something that is a really core part of what it means to be human, and that our mental health is a part of us that has this really powerful potential to help us to grow, to help us to develop. And I think very importantly, I think the point you raised, Meera, also it helps us to cope with distress. It helps you to make sense of distress, and then when you need help, you know what those options are. You feel more comfortable to reach out to them. I think it is a separate issue, however. I mean, in a country like India, where those options are really limited, especially for young people, there's a handful of helplines, there's a handful of sort of uh, professional services that are actually within the access of the average young person. And I think that's a separate issue. So I think, we do place a lot of emphasis, for example, in our work on really equipping young people to be able to make sense of their mental health, to know how much of it they can support on their own and when to reach out, because there aren't, unfortunately, enough services or knowledge about how to access these at all for young people. So again, I'll sort of bring it back to your book and say, I mean, I think it's very important to highlight the options that do exist, and also to again lobby for increasing, whether it's mental health care workers, counselors, funding from the government, and so on, to actually build this up. We're going to need a lot of this support, particularly I think in the next few years.
If I can,
Thanks,
jump in here
Pattie,
and,
Meera. Yeah, go ahead, Dr. Sen.
sorry. So I thought, if I can add a few other thoughts that I was having in continuation to what Meera and Pattie have said. Um, to understand that suicide is a culmination of a series of you know very complex dynamics and sequential things that happen, which ultimately leads to such thoughts and behaviors eventually, isn't it? And I don't think, again, we have the sensitivity and the awareness in our community to be able to see that happening. So often, and even when it comes to the eventuality of a suicidal act or high risk of it, oftentimes it is minimized, as Meera was saying, by calling it, attention-seeking behavior, or that how can you be so weak, or how can you do this to us? This is absolutely unacceptable, and so on. And not once considering what has made this young person over a period of time, not at the spur of the moment, as a fancy or a fad, that this person has come to this juncture, and that dynamic process of how this develops, etc., is something that conversation needs to happen in different spaces. And I think it could be anything. It could be to do with parenting, it could be to do with bullying in schools, it could be to do with, again, accessing mental health in schools or helplines, etc., the stigma around it, and so on. So all these things have to come together to be able to, let's say, even address something like as in a way as kind of devastating and yet so complex. The phenomena of how the suicidal behaviors develop is so complex, over a period of time. To be able to understand it, we engage it with it in different in different spaces, in different layers. I do believe that it needs to be, the approach needs to be multi-tiered. And I think that, again, some of what you have done in this book is to be able to highlight that. You've got in a professional angle, you've got in personal journeys, you have got organizations who have represented, in the way they have dealt with it in the community. And that brings that, the different layers that we need to be able to understand and deal with it.
Yeah, and for those of you who are joining us, we have some incredible first-person lived experience-centered narratives in the book, including Anvesh Pokuluri, a young former IIT student, Manisha Chatra, you'll hear from probably next weekend or the weekend after that, as we plan more of these panels where they've been very open about suicidal ideation. Again, the best practice for reporters joining us: please go through the WHO guidelines. Please don't speculate about reasons or cause for death, and always share that help is available. Paris, I want to touch upon something that comes up often in conversation, which is that we know that the statistics in terms of the supply demand, when it comes to the need for mental health resources, we know it's completely skewed. Often people will come up and say, look, I'd love to, first you go through this whole thing of who do I seek help from? And Meera has very helpfully explained, do I go to a therapist? Do I go to a psychologist? What's the difference between a psychiatrist and a psychologist? Once you figure that out, and you get a reference to someone, you are faced sometimes with a very unaffordable option. Can you take us through how the alternative story is looking at that, and what are your thoughts on sort of the costing model of all of this?
Absolutely. I think, in continuation with what Pattie and Meera were saying earlier, as somebody who ran helplines earlier on, I know that even with significant funding, helplines are very saturated, and that's the reality of the situation. So, to just put the entire burden on NGOs, helplines would not be fair. I think when we started off the alternative story, one of the things that we were very conscious about doing was that the cost of mental health care, especially private mental health care in India, is quite high, and there's no one price point at which anyone is able to afford the services. So, with the alternative story, what we've tried to do is that we've kept a portion of our services, almost 1/3 to sometimes even half of our available sessions in a month, available at a price point where people can dictate the price that they can pay. Instead of us deciding what they should pay, they decide what they can pay. And we've really been able to reach out to a lot more people this way, because had we not been able to provide services at a highly subsidized rate, a lot of these people would not have been able to afford therapy. I know that when I was working in the social sector, as a starting professional, and I needed therapy, I know that I had to drop out because after a point in time, I couldn't afford the cost of my own therapy sessions. I mean, it's hard to pay 1,500, 2,000 rupees 3-4 times a month for somebody who has a 20,000-30,000 rupee salary. And mental health services becoming affordable and accessible in a timely manner is such a huge piece of solving this need gap that we have in mental health. I mean, right now, if you look at the care gap statistics in India, 7 to 8 people out of 10 who need mental health services are not going to be able to reach them. And as the number of people who need these mental health services grows, that gap is going to widen even more. So affordability and accessibility, like I said, is at the heart of solving this problem. And that's what we've been, in the last 2.5-3 years as the alternative story, trying to do our bit towards solving with our pay what you want model.
Thanks. And all of you tuning in, you can check out the interview with Paras on that model and how it actually works in our book. And I want to also say thank you all for your patience. I'm having fluctuations and increasing heart attacks with the Wi-Fi bandwidth in my house, but this is the brave new world we were promised, I guess. I want to put this question to both Meera and Dr. Sen. Venkatesh, my former colleague and friend, saying, when we say young mental health, is there any such thing as too young to talk about mental health? How about talking with children below 9? And I want to link this to something both Meera and Dr. Sen have pointed out in their interviews in this book. Meera, in the introduction, in fact, saying you tend to see children and families coming in when problems have escalated to a great degree. And that's one of the biggest concerns, Meera, that you pointed out.
Yes, that's right. So I think your first question, Amrita, this question's come from, who's this question come from? The one about, I can't hear you. Can you hear me?
Mr.
I've lost connection.
I think.
Oh, yeah,
Mr.
okay,
Rao?
okay, back.
Yeah.
Yeah, sorry. I think the connection is a little. So yeah, so children with younger children, the conversations are maybe they may not have the language for it. So we do play therapy with younger children, and so that's a wonderful way to connect with children who may not have the verbal capacity to communicate or the language for the feelings that they may be experiencing, difficult feelings. So play therapy is for younger children. And as children grow, I find even with older kids, a lot of play work has been helpful in communicating and working in a therapeutic process. So I think if Amit would like to add to that.
Yeah, so I think one of the challenges of young mental health has been this, the perception that children who are young do not have mental health problems because they do not have the psychological sophistication even to experience some of those things, right? Which is far from the truth. till the 70s, they didn't think, 1970s, they didn't think that children or adolescents even perhaps have depression, So it's taken a few decades to establish this fairly firmly. And indeed, like Meera was saying, that the expression of their mental turmoil, whether it is anxiety, even depression below 9, or effects of trauma, and of course the developmental aspects of it, how children, when they are not able to cope up with things, whether it is in school or home, or have social difficulties, etc., they have a range of psychological, the impact emotionally is huge and very deep indeed. And in fact, there is growing evidence, and we see this even in our clinical work, that if we do not address it at that time, those same difficulties can become much more complex when these same individuals become older, adolescents, or even adults for that matter. So we now know that adverse experiences in early childhood, traumatic experiences early childhood, things like attachment, bullying in very early years of school, etc., can have deep psychological impact. And if you're not able to see that and address it in some form or the other, in some way, like perhaps through play, perhaps through stories, and sometimes you'll be astounded by the sophistication in the way young people can actually vocalize and verbalize or express it through art forms or play, etc. Their inner world. And again, it's a matter of how open and sensitive and what are the kind of forums or formats you can or creative ways of actually reaching out to young people and engage with them, and the more we do that, the more we'll see and be able to appreciate this huge space of psychological distress, illness, if you like to call it that, developmental issues. They all come together, and I think it's absolutely paramount that we address it.
Thank you so much. We're getting another question from Siddhant Agarwal. This is to, I'm just directing you to Pattie and Paris, but you all can weigh in as well. Do you think that, like we have regular physical health checkups for work, we should have something like checkups for mental health as well, where we consult a professional at least once a month? Pattie first, then Paris.
That's an interesting question. I almost want to defer that to Amit, but being the non-professional, I'll answer. But I mean, I think the short answer would be maybe in an ideal world, sure. But I think the idea of also, caring for our own mental health is that there's a certain part of that we should be able to do and we should be equipped to do. However, I think understanding that mental health is very dimensional. There might be moments in our lives or moments fairly regularly when we do need that extra bit of support. But that extra check-in, it could come, for example, from your friend, from a trusted family member, from a different kind of professional. It needn't be necessarily, a clinical psychologist or a counselor. It could be from somebody who is trained to help you. So yes, I think in short, sure, in an ideal world, yes. But I think, young people at the same time need to be equipped with a set of at least basic coping skills that help them to sort of ride these waves, especially the wave we're in now. Something, I mean, this is a little bit sort of anecdotal, but in chatting with my own parents who are in their sort of 70s, 80s, I found it interesting how, they haven't been as impacted by the sort of social or psychological impacts of COVID in quite the same way as a lot of the young people that we speak with fairly regularly. And I think in a big part, this is because obviously partly to do with life experience, but the other part also being that, this generation of, young people also has never experienced this. And it's not something that's encouraged either in school or in families, which is to, build that kind of resilience. We are not all born with it. There's a lot of things we need to do to nurture that ability to cope. So I would say, if you can build that capacity in young people to address this as much as possible for themselves and for others around them, and the people who really need the help, there must be enough help for them. So I mean, I'll answer it that way.
Paris?
As somebody who lives with mental illness and takes medication, I'm also mindful of the fact that we shouldn't, go to the other extreme and make it an over medicalized problem, like you see in some other countries like America. My answer to that, I think, is that we definitely need to do a lot of stuff for preventive mental health. And the answer for that is not necessarily interventions like going for a therapy session on a monthly basis. It could be group initiatives. It could be better leave policies. It could be better compensatory policies. It could be more flexibility in terms of how school work or assignments in colleges are done. It could be like Pattie said, checking in and reaching in rather than always asking people to reach out for help. Definitely, there needs to be a lot of preventive mental health actions, and there needs to be support available if somebody were to feel like they need to go for mental health, interventions on a monthly basis. But I don't think the answer to that is necessarily making sure everybody mandatorily goes for therapy on a monthly basis, or we do mass testing of people to scan for anxiety and depression. I definitely think that creating an environment where we can talk about these things freely, openly, without prejudice, without judgment, without fear of any kind of negative consequences, and where we acknowledge that just like people get physically tired, they can emotionally and psychologically also get tired and exhausted, and there should be enough safety valves in all of our mechanisms, whether it is families or whether it's academic or professional sectors. I think that's the answer. I'm sorry about my dog in the background.
Your dog agrees, clearly.
I,
That's your chorus.
yeah.
Yeah.
No, I agree with Paras so much that it cannot be a medical, lens. It can't be a set of, like you do in the medical screenings, you do a set of blood tests and say, oh, hey, your blood sugar is high, you go and see the specialist. It has to be an ongoing thing which is weaved into our lives, I think, and it at a different stages of our lives. Like, if there are young parents, they should learn about parenting, about attachment, about creating spaces that are safe. Similarly, in school, they should look at bullying, they should look at circle time. When they go up to colleges, they should talk about other mental health and relational issues, including depression, perhaps, which is so high. And then again, in the office space, one can then talk about how you, just like Paras was saying, having a more flexible leave policy, or for instance, in our organization, we not only have supervisors for each individual, but we have a personal individual mentor. And so there's a lot of support that is given to each individual to be able to and because we believe that our profession itself is a high stress profession. And particularly if you do it with your heart and soul, it rubs off on you and you need some safety valves. And so at different spaces, I think the preventive aspect of it is really vital. And I think that will happen only once we begin to understand the impact of mental health in various aspects of our life. When we talk about extremes like suicide, and typically speaking, for instance, if you go to a school, most schools, if a child becomes suicidal, they'll say, keep him home, don't send him, because that's risk not only to him but to other children also. We don't want to handle this anymore, right? But if you told them that the mental health of children will impact the way they perform in exams, they'll probably look up, sit up and begin to take this seriously. So it's about how you understand the impact of mental health in different spheres of our development, of our lives, of our relationship. And that may begin to then make other people sit up and and they might feel they're stakeholders as well in this whole business of mental health.
Yeah. I think in India, if you put exam into any 3 sentences, you'll get more stakeholders interested. Pattie, you wanted to say something, and then we'll add in some of the comments that are coming in.
Nice. I mean, I think it's just to pick up on both the points that Paras and Amit just mentioned. So this is just, I mean, it's a small example from our work with students in schools. So something we've seen is when we screen students for sort of mental health assessment. So for example, we run a program at one of our sites in Goa, which is what we're calling open access. So I think going back to Paras's point also of, letting people join these kinds of interventions if they need it. So we tell kids, hey, if you're feeling stressed, you need help solving problems in your lives, come sign up. So what we see is, I mean, 3/4 of students do not actually screen as meeting clinical criteria. So I'll put it the other way: 1/4 screen as meeting criteria, but of those students who sign up, 3/4 actually show that they show a high level of what we call sort of functional impairment. So they are very distressed. They just don't meet the criteria on a mental health questionnaire. So what are you going to do in that case? I mean, I think it's very interesting where, you know, you're seeing you may not be clinically depressed or clinically feeling anxious and so on, but you really want help. You don't feel able to cope. And I think that's where it's very important, again, to emphasize, you know, simple things like teaching kids problem solving can have a profound impact further down the line. And again, there's a lot of research to show that interventions of this nature can help kids in the long term. So you're not only thinking about mental health from the lens of therapy or that kind of sort of strict professional support. You're thinking, you know, things like life skills training can help children to, you know, deal with the stress of the various different stresses of life, whether it's at home, at school, in their neighborhood, and so on. So I think, you know, it's not a one size fits all kind of approach. And I think to keep going back to that, and again, I think both the points made, it is much more than a medicalization. Mental health really is, I mean, it's everywhere.
You know, we've also, just for those of you joining us, really encouraging you to go through the book, because you'll find very, very different facets. We can't cover it all. We have about 10, 15 minutes left in this chat. We do touch upon depression, anxiety, stress, linked to a lot of the studies, you know, and Pattie had pointed out the R. Parekh et al. Study that 1 in 5 adolescents surveyed, you know, at that point said that they deal with high stress every day. You know, Dr. Sen, in one of our interviews, had told us, you know, everyone comes in talking about exam stress, but, you know, you have kids as young as 12, 13, talking about relationship stress, talking about, you know, concerns to do with peer pressure, with bullying. So we can't touch upon each of these. So I'm going to try and get, firstly, everyone who's watching, if you can afford to, please buy the book or share it with people who it can benefit. But let's get in some of these questions. And this is, you know, to the panel. I think Meera, Dr. Sen to go first. Rinchin Palmo has been very patient and sent in one question. Could you also speak about resources or individuals available in languages other than English and Hindi? Because we have people coming from a wide array of cultural histories, and it's important to acknowledge the role of language in making the narrative of mental health experience more exclusive than being inclusive. I'll give you guys a second to go over that. And since my mom was watching, she always makes me point out I'm not a therapist. I come to this from, you know, as a storyteller, as a journalist. So luckily, I don't have to answer the tricky questions. But over to the experts on the panel. Anyone want to give that one a shot?
Wow. I mean, that's a fabulous question in itself, I think. You know, indeed. Yeah, I mean, we tend to assume that people who need mental health care are probably going to understand the language we speak, and that may not be so. There are so many cultural differences that come with the different languages and the spaces they come from across the country, I think. So I don't have any ready solutions to it, honestly, but I completely acknowledge what Rinchin is bringing to this forum. And some of the books are actually beginning to get translated into the local languages. You know, for instance, one of the parenting books one of our colleagues has written, Shailaja, has got translated into Marathi. It's probably going to get translated into Hindi very soon. So these are things that perhaps we can do. That's all really.
Is there anything else? I think it's well noted. Rinchin. Meera, do you want to go?
Mm-hmm. Just add a few things to that. Just to say that I think from a psychotherapist language point of view, in terms of being able to do therapy in different languages, I think as personally, I mean, I have been open to doing therapy in Hindi, in Tamil, and I realized that how the whole therapeutic process changes the meaning and the whole relationship when you can do it in the language that is most comfortable for the client. So I think from a psychotherapist point of view, I think just offering your services in different languages would be also a start. So this is to address the individuals who are available. So I would just kind of like to add that.
Yeah. In fact, sorry, if I can also quickly add, there's another thought that came to my mind that, when we talk about languages, sometimes it creates a power dynamic. and if you are speaking in English and using a lot of jargon, and somebody who speaks Hindi or Tamil or Bengali is not able to understand it, immediately there is a sense that, oh, I know it all, or this is more sophisticated than the way you speak about emotional distress, your personal experiences, and that is problematic as well. And in fact, in the one of the kinds of therapies which is in fact we most of our therapists use as a central form is narrative therapy, where social justice and the power equation between the therapist and the client is again taken as very important, and indeed this issue about language, the kind of words and metaphors that you use becomes so important. And to be for the therapist to be able to see that, and to have the humility to be able to say that I don't understand your language, it doesn't mean it's inferior, but it's my shortcoming. It's indeed my shortcoming that I can't understand your language, your space, your culture, and I'm sorry about that. Help me understand it, and that can be a collaborative process actually in therapy, to be able to then delve into those spaces where I might be completely naive as a doctor or a therapist, and I'm willing to learn. And that again, I might also want to say here that so much of learning happens as a therapist in my life, at least. I think my life is much richer due to the young people and the families that I meet. Much more than anything else, honestly. Yeah.
Paris, you wanted to add something?
Yeah, I just wanted to, say that it's a very important issue that Vincent brought up over here. And I'd like to extend that to not just language, but I think also lived experience. So one of the things that, and also we always try to do is that ensure that the team is diverse and the team has representation. So one of the ways in which we answer this issue is that whenever we look for a new therapist, we look for English, Hindi, and one Indian regional language in which the therapist can fluently deliver therapy services, and also helps to consciously go and look for people who speak a certain language, because there are language groups which are underrepresented in therapy. Whether we look at southern languages, whether you look at northeastern languages, you see that people from such cultural backgrounds are underrepresented in the therapeutic space.
Yeah.
And the other thing that we also consciously try to do is have queer voices in therapy, trans voices, in therapy, because it's not just the language, it's also the lived experiences that come with those languages. And I think it's best understood by a person who shares that cultural identity, or that gender identity, or even caste identity. I think caste, gender, sexuality, language are some of the intersections at which you see people from marginalized backgrounds, both as clients and therapists, being left out of the mainstream. And I think intersectionality has to happen on the hiring side as well for therapy, and for the training as well. I mean, we need more vernacular language speaking therapists. We need more Dalit, Bahujan, Adivasi therapists. So some of the resources that come to mind, the Blue Dawn does some fantastic work giving voice to Dalit, Bahujan, Adivasi voices. White Swan Foundation has a multilingual portal which has some fantastic resources in multiple languages. ICOL has counselors speaking multiple languages. We have counselors who speak multiple languages. So I definitely do see that there are initiatives which are now taking cognizance and making meaningful efforts to include more diverse, individuals into the fold when it comes to mental health, rather than making services available only in English and Hindi.
Yeah. Thanks so much. We are going to be a little bit short on time, but I want to get in as many questions as we can. And then I'm going to ask our wonderful panelists to help us answer what we miss, if we can do that later. Two people have asked this. Dr. Sen, maybe I'll put this to you. Dr. Khushbu Rani, and I think somebody called Mukesh, 49 million. Anyway, Mukesh and Dr. Rani, can children as young as 2 have depression? I'll put that to Dr. Sen, and then Vanita's question to Meera.
So yes, indeed, there is a different manifestation of what you might call depression in the 2-year-olds, right? And usually it's to do with the core attachment relationship that depression takes place. When that gets disrupted, right? And it is seen, in well, the first time they actually identified that was during the Second World War, when first fathers and then mothers went away to work, and there were many orphans, especially across the world, in Europe and in UK, and they did some studies about these attachment behaviors and what was happening to these kids. And some of these kids who did not have very clear attachment figures started developing a syndrome, which was called failure to thrive, where they actually stopped feeding and they start withdrawing completely. And in the beginning, they would be crying, would become clingy, but eventually they would completely freeze, and many of them started dying. So you can imagine the emotional impact on kids. So the emotional need of a child is there right from the beginning, even when the child is in the womb, right? And from the time the child is born, this constant interaction that they have with their primary caregiver, and the love, the nurturance, the bonding, the attachment are vital things. And when that goes missing, then in 2-year-olds also you can see these signs, and these signs can come in many ways. For instance, they may not pick up the milestones, or they may pick up some milestones and lose them, like stop speaking, or might get toilet trained and then again start wetting and soiling their clothes, right? Or they might completely become mute or become extremely clingy and have repeated tantrums. So there are many ways that the expression, that little children express their emotional distress. And indeed, there is a correlation, perhaps even a scientific correlation, that people have found of how kids who suffer in those ways when they are very young have a much higher propensity of developing the more adult kind of depression later in their lives. So you can see the correlation there as well. So no, 2-year-olds can definitely go through depression, but usually it is to do with their primary relationship.
Thanks, Dr. Sen. Meera, can you take this question we have from Vanita about children being taught about emotions and to regulate emotions and feelings?
Yeah, sure. So yes, Vanita, you're right, absolutely right about the fact that children do need help with regulating their emotions and feelings. And this does happen in the parent-child relationship, and the parents are the ones who help with the regulation. And you said that how can we as parents do that? Well, the thing is that, parenting is hard. And I think there are some emotions that can be hard for even parents to manage and regulate. For instance, if your child is having a temper tantrum or is crying excessively, it can be very difficult to regulate that. So, getting help for it is one of the things that I would normalize. You can get some support to understand some tips, again, accessible sort of information, that some things that we've provided also in the book, ideas around how you can regulate and comfort your child, are things that can be learned and taught. So yes, I just like to say that yes, parents do help with emotional and emotional regulation. Yes. Yep.
Thanks, Meera. And Paris and Pattie, Anshuman has asked a question about, and I think this is pertinent what you were saying earlier about making access to health more inclusive. How would we look at people who have less privilege when it comes to detecting and addressing mental health issues? Are diagnostics and treatment affordable at all, and how to reach out?
Yes, I think whether it's a privileged community or an marginalized community, I think let's firstly believe that there is wisdom in all cultures where we understand and appreciate mental health. It's just that as mental health professionals who gain a lot of our learnings and our knowledge from textbooks written in the West, sometimes we don't have the language to communicate with the marginalized. And as Dr. Sen said very wisely, it's our shortcoming and it's our weakness that we haven't acquired that language yet. I've found that whichever initiatives that I know have gone to the grassroots and have tried to understand mental health, as an idiosyncratic understanding of a grassroots level, they've been able to do some really great work. So I think it involves us stepping out of our offices, going to the field a little more, doing an ethnographic understanding of mental health concerns as understood by people of various cultures and languages. That's part one. And part two, of course, the penetration of mental health services at the district level, at the taluk level, is the only way in which we'll be able to reach out to a wider set of people than we are already. if I were to answer the question, are they affordable right now? They aren't. They aren't. That's the sad truth of it, which is why the care gap is as big as it is. And where it is free and affordable, the centers available are either located at very far off places for people, or they are overwhelmed already by demand. So the waiting lists over there are huge. So long way to go in terms of addressing that, honestly speaking.
Yeah.
So
Pattie?
if I can add to that, oh, sorry, go on.
Please go ahead, Amit. Yeah.
No,
I'm happy to comment next. Yeah.
All right. I just wanted to say that I think we have to be, as mental health professionals, feel responsible for the very multidimensional society we have around us. And we have to figure out ways of how to reach to these different spaces. So, for instance, although ours is a private organization, we go out of our way to engage with various NGOs. The first and foremost being Salam Balak Trust, who we have built a mental health service with. But there are many others, I mean, there is Tara Homes, there is Courage Homes, there are many such different organizations we work with. And we also go to, the government schools, the NDMC schools to do parenting work, to do, again, a lot of the preventive work that we were talking about here, life skills education and so on, right? So how do we do that? I mean, we actually, reach out to corporates, we reach out to other people who might contribute to this. And sometimes we see them completely free. I mean, nobody is refused treatment in our service. Anybody who walks in through the door, anybody who's referred is given treatment, whether they can afford the full fees or not. Where we get it from is another question. That is our responsibility to figure out. It's our job to be able to then connect with the larger community, to make an appeal to people, to say that, look, these kids need it, so you have to come and do something about it. And there are so many who do, and we have various organizations, the Shri Ram Foundation, the Sleepwell Foundation, etc., to name a few, who support us in so many different ways, despite us being a private organization. But you have to take the initiative. As mental health professional, nobody will come to you and say, hey, can you? I mean, actually, there are people who do that too. There are people who will come and ask you for your services sometimes and say that, we'll be willing to support you. So there are many new and encouraging, exciting things that are opening up in these spaces as well. I just wanted to share that. And I think that as mental health professionals, it becomes our responsibility to tap into that.
Thanks, Dr. Sen. Pattie?
Thanks. Yeah, I guess I'll just focus a little bit on sort of information campaigns around help seeking as well. So I think Paras already covered really well. I think the point that, mental health care needs to be integrated into primary care. And there are examples of this being done. For example, even Sangath, does work with ASHA workers, with training day health workers, training teachers to deliver basic mental health care interventions. But in terms of, again, I think going back to that point earlier that I raised, you cannot have a one-size-fits-all approach even to advertising a helpline or a service. So, for example, if you're putting an ad out for counseling on a website, it can't just be in English or it cannot just be in Hindi, then you're not going to be able to cater to more people. If you cannot just opt for internet counseling, for example, many people may only have access to a telephone, or they may not have access to a telephone at all. And what we're seeing, for example, in India is a vast majority of India does not have access to the internet. It does not even have access to telephones to call in for helplines. So, and this is particularly in light of COVID now, we know that there's an urgent need for face-to-face services, and these can be implemented safely and using adequate, health and safety precautions. And I think secondly, coming back to even phone counseling, thinking about, there are many young people who can't access the phone counseling options that exist because they can't even make a call in their home to express distress and so on. And we're not just seeing this in India, we're seeing this all over the world. And finally, I think, again, Paras highlighted this. I think you need to sort of systematically understand what each of these barriers are for a young person to access help, because it could be from as simple as them not being able to pick up the phone for a helpline, but it could also be for, a range of other intersectional issues, which, as Amit said, you need to tackle other problems also, whether it's, poverty, violence, caste, class, gender, sexuality. People with serious mental illnesses and young people with serious mental illnesses need a different kind of care as well. So I think, it's not just one approach. So I think one needs to be quite targeted also when thinking about how am I going to help young people's mental health. And finally, I think just to go back, we do have a legislation in India, which is the Mental Health Care Act of 2017. It does make adequate provision in theory. It's just simply not implemented. So I think, we do need to lobby the government. We do need to demand what is sort of legally should be available. And it would help to bridge even a portion of that care gap. But I mean, people need to come together to demand this. Otherwise, I think NGOs can be doing this, from now till forever. It's simply not going to meet the burden and the sort of the number of people who need this support.
I think we always try to say everyone has a role to play. This is my role. I'm going to take this comment. I have the expertise to take it. Sanika saying, thank you so much for organizing a great panel. Sanika, thank you for noticing. Those of you who've been watching, thank you so much for joining us. I'm going to volunteer Meera's time along with mine. We'll be doing more of these chats as we, I did want to get last words from our panelists, but now you're going to have to send me those videos with your message to everyone to buy the book. Thank you all so much for joining us. I'm going to hand over to Abhay for, so that he can wrap this up. But Dr. Sen, Pattie, Paras, Meera, thanks so much for your time. Who knew 1 hour would go so quickly on a Sunday?
Thank you so much for organizing this. Yeah.
Abhay, I'm not sure we can hear you. Can you guys hear Abhay?
No, we can't.
No. Can you?
Yeah. Yes.
Yeah. Okay. So on behalf of Simon & Schuster, thank you very much for joining this discussion. I just wanted to tell our viewers that the book is available for sale at a special discounted price on the Kindle store. So do definitely go and grab your copies today. For fans of paper books, we're hoping to have the book out very soon. So keep following our social media accounts, and we'll have that announcement up there. Thank you very much once again for tuning in.
Thanks, everyone.
Thank
Bye.
you. Thank you. Bye-bye. Bye.